City of New Orleans, 911.
Hi, can I have an ambulance?
Tell me exactly what happened.
My cousin is having a seizure. He has seizures all the time. He's on medication right now.
Okay, is he awake?
No, ma'am, he's still seizing nothing. Another one about to come on. Lay back, lay back, lay back. I'm right here. Lay back. Give me a towel. I'm right here. I'm right here. He's still seizing.
Okay, ma'am, I have EMS and the fire department coming out to help you.
0505-year-old male unconscious after having a seizure.
Chilling. Something that, like, raises some concerns. It could be a febrile seizure. It could be, like, he could have a history of seizures. Because 5 is a little old to be having febrile seizures.
Yeah.
It can still happen, but...
Is it me or are the seizure calls? I feel like have been increasing lately. I feel like we've been on a lot.
I feel like we go to seizures all the time.
I know.
But, like, steadily all the
yesterday
time.
we had like 3 of them.
Mm-hmm.
Yeah. Usually by the time we show up, they stop seizing.
Yeah.
Seizuring.
Seizuring. Is it seizuring or is it seizing? Pretty sure it's seizuring.
I'm gonna have to give that a Google.
A goog.
Give it a goog.
Give it a goog. Let's see. Hi. Oh, he's not 5. It's not a 5-year-old, it's a 33-0.
I'm good.
Hey, baby.
I'm just tired. I'm good.
You're just tired.
Huh?
She said that you had a seizure.
I'm good.
Well, let us just check you out, okay?
Huh?
Let us just check you out.
This is what he's taking at the moment. Now, this is how he is when he comes out of the seizure.
Really? Do you remember having the seizure at all?
Huh?
Do you remember having the seizure at all? Can you tell me where you are right now? Can you tell me where you are right now?
No.
Good. Can you tell me what city we're in?
New Orleans.
Can you tell me what year it is?
2021.
There you go. Let us get y'all checked out, my man. You're still super sweaty. You're still breathing pretty hard, okay?
Our patient's awake. He's talking to us, but you can tell he's super sweaty. He's a little confused, but he's awake and talking to us, which is a good sign. Means that most likely he's not actively seizing at this point.
They usually come in twos.
Twos? How long between, like, before he goes into another one?
Basically, if he stands up and goes to the ambulance with you guys, he's gonna have another one in the ambulance.
All right. Why don't we just go ahead and get you to the hospital, all right?
I'm straight.
Well, she said that you normally have 2 in a row.
20 row what?
Seizures.
I'm good.
So if you've already had 1 seizure,
I'm good. I promise you, I'm good. Just,
you still sweating bullets, my mans.
I'm good.
But if you have another seizure,
I'm good.
all right?
His significant other tells me that he usually has more than 1 seizure in a row. She doesn't know when the other seizure's coming, but she knows it's coming. So it's incredibly important to get this guy in a controlled setting to where he's not seizing in this house, and then we're trying to have to fight him, give him drugs to sedate him, and then try to get him out of this house to the stretcher.
I gotta lay back down. I'm good. I just wanna lay down.
I know you want to lay down, but we got to go to the hospital.
I'm good. Trust me.
Just don't rip any of the stuff off, but definitely got to go to the hospital. Huh?
I said I got a headache.
Well, I'm sure you have a headache. Come on, let us take you to the hospital, my man.
I'm coming with you. I'm dressed, I'm ready. I'm coming right with you. You're not gonna be by yourself at all. And that's the only way I'm gonna be able to sleep tonight.
All right.
All right.
Well, I want to get you to the bed outside, okay? We got to get down those steps.
All right, let's get you up out of bed.
Oh, all right.
You ready? Come on.
I'll take a couple steps, okay?
You can step?
Yeah.
All right, come on.
I'll see you in a little bit.
All right, come on. Oh, what is that? That don't look good at all. That looks like straight blood. That don't look good.
Let's try to sit in this bed, okay?
Let's get you to lay back, all right?
Right now, this call just got a lot more serious. I'm like, where is this blood coming from? Why is he throwing up blood? Did he bite his tongue and he just swallowed a ton of blood? Or does he have some kind of uncontrolled bleeding inside of his stomach? If he has another seizure, is he gonna start projectile vomiting blood and then choke on it?
Are you allergic to anything?
We gotta get this guy to the hospital.
I'm ready to go. Okay. I'm gonna give you some medicine that's gonna help that nausea, okay? Have you ever had any like GI problems? No. I had to put you on a little bit of oxygen because your oxygen was a little low, right? I think you made the right decision about letting us bring you to the hospital. I think you're a lot sicker than just having a seizure.
Mardi Gras colors going on the dome.
It still feels crazy getting around the city this easy.
Like we beat back-to-back calls.
I remember the first year I worked at ASAP on Mardi Gras weekend.
Now this was your first year here?
First Mardi Gras working with New Orleans in it.
Hey, they put you on ASAP?
I was on ASAP. It was one after the other. And so me being new to the city, to this EMS system, to this behemoth of a holiday in New Orleans, I'm like 7 calls behind. I think it was Keely or somebody. It's like, you trying to type your whole narrative? I was like, yeah. She's like, nah.
Unknown age, under gender, down, breathing. First came out as a seizure, now they're doing CPR. Code 3 in the 5th, you're in OPD in 6249.
So we're going, sounds like a cardiac arrest, came out as a seizure, and now they're doing CPR. Holly's going with us, Holly Jolly.
Holly running my ass off tonight, man.
Some people do have, you know, what's described as seizure-like activity before they go into cardiac arrest. So my gut is telling me this is an overdose.
The fire department's on scene. That means that there's less equipment that I have to bring in, and that means that they've already initiated some form of care.
6249 on scene.
We inside or outside?
Oh, inside.
Yep, I see Holly lugging her stuff in there.
Is it a code, guys? Okay. Does it look like an overdose?
Yeah. Just stand by the counter and she just feel those. Just grab her chin nose.
Of Narcan?
Yeah.
Perfect. What's our pupils look like? They pinpoint?
Yeah.
Okay.
Giving Narcan intranasally can sometimes be less effective than giving it IV, which means in cases where we don't really see a good response, we want to try to give a lower dose IV to see if we can see a more rapid improvement.
What's going on, huh?
Hey, looks like an OD. They gave her 2 of Narcan IN already.
Is she breathing on her own at all, dude?
A few, yeah, a few little agonal ones.
All right, fellas, let's lift up, get on this stuff. 1, 2, 3.
She still ain't woke up.
Let's continue to bag her, man.
Opiate overdoses can be reversible if we could give Narcan in time. But you know, the longer that you don't get that Narcan to block that opiate, you just won't be breathing, which can make you hypoxic.
Hopefully the IV Narcan wakes her up.
I'm sure it would. It's time to wake up, sweetheart.
You getting any response at all out of her?
I can feel it. She's breathing on her arm, but it's still like 6 times a minute.
Ooh, look at that.
Yo.
What?
Little polyform.
Oh, okay.
When I find a little baggie with all the assorted pills and the white powdery substance, that complicates things even further because the patient is obviously suffering from an opiate overdose. But there's a strong possibility that there's something else in her system, and so we don't know what's gonna happen when we push this Narcan.
That should go a little bit. Oh, there you go, there you go. Oh, hold up.
It's paramedics.
No, come out. Hold on. Calm down.
Get some restraints.
Yeah.
Let me see that on.
We're responding to a patient with a suspected opiate overdose, but it seems like it may be something else in her system.
That IV come out over there too.
You all right, baby? Calm down. You all right? I'm gonna tell you what happened. You passed out, but now we got your back. But I need you to calm down. All right. You just told me you was gonna calm down.
It's not even.
Oh, you can't help it? Is that stuff? All right, what did you do, baby?
Just take that tape and wrap it around
Did you snort it or did you
snort it.
You snort? How much did you snort?
A lot.
A lot? I believe it.
There you go. I'm gonna try to get another line and we can just give us some Versed.
Don't give me no more of that stuff.
Do we not?
All right, baby, we're gonna give you something to help you calm down, okay?
I can't help it.
I know, love. That's why we're gonna give you something to make you feel a little better. It's gonna calm you down.
Please.
She's just agitated. And so it's either one or two things that's the cause. It's the fact that we just rapidly detoxed her, or it could just be that she's speedballing. So we're gonna give her Versed so that we can kind of get her back to a more normal state. All right, I gotta get this IV to give you medicine, okay? Can you hold still
Look,
for me?
let me wipe your mouth, love. You all right? You all right?
All right, mama, that's it. Now you just gotta hold still.
Almost done.
Don't move. Don't move. You're good. You're good. All right, give me the damn Versed.
Yeah.
All right, 5 is in.
It's gonna stop.
Yeah, it's gonna stop.
That medicine should kick in any second.
Night right now.
All right, her sets. All right.
Shoot.
Put on a little O twice.
Oh, yeah.
Look, oh, twice.
Whew. I ain't coming on no more calls with y'all.
Look, you making us work way too hard.
Y'all drama.
Let's go, man.
Whew. All right, y'all be careful.
All right, thank you, Holly. All right, baby. We got you, love. You all right. You done wore us out.
Now we're headed to a female that's stumbling on the street, possibly fell and hit her head, but they're saying that now she's just like sitting on the curb. And a good Samaritan thought to call it in.
Do you think we're gonna be like busy Mardi Gras, even though they're not having like all the parades and stuff?
100%.
Like, this is New Orleans, like it's Mardi Gras. You can cancel the balls, you can cancel the parades, but you cannot cancel Mardi Gras. 3250, we're in there. Hi.
I caught her walking in the middle of the street stumbling.
Okay.
I know she had some head injuries, but it seems like she's 19.
Okay. Hey, baby. Hi, sweetheart. Oh. Oh, I know this girl. She likes to fight.
Mm-hmm.
Oh, yeah.
She swung at you?
I've been swung on by her at least like 5 times in my career. Thanks. I know exactly who this patient is, and she is a feisty one. So if I approach her in an aggressive way, this whole situation's gonna go downhill. So it's just gonna take a little finesse, you know? Hey, sweetheart. Hey, look. You were stumbling around, okay? So we're gonna take you on over to the hospital, all right?
Drop 3243's item.
You can't see?
Show me around.
Intoxication can mask signs and symptoms of brain injuries and neurological deficits from head injuries. So we need to get her in the truck to be evaluated.
All right, baby.
Hey, my love.
You ready?
3249.
There we go.
3243.
Perfect.
3249.
We got a couple seatbelts for you, okay? No, we got a seatbelt in, okay? We gotta stay seatbelted, okay? No, we gotta stay seatbelted in.
Where's the man?
Stay in.
Stay seatbelted in.
Where is she at?
He's right there.
Should be.
Yeah.
You're gonna be all right now. You're welcome now.
You gotta stop undoing them seatbelts.
No, you're not doing anything wrong, but you gotta stay with the seatbelt strap. Mm-hmm.
Seatbelts stay on. Seatbelts stay on. Don't take them off again.
You hit the wrong bitch.
We just trying to help you. No, we're not talking about that.
Y'all ready? Man, beat the out you.
No. Stop.
You think you strong?
Stop.
Man, why you have to go and do that?
Just go ahead and, yeah.
Lindsay and I are responding to an intoxicated female with a possible head injury. But because our patient is trying to unbuckle her seatbelt, we have to restrain her to the stretcher to make sure that she doesn't try to jump out of the back of the ambulance.
All right.
That's better. Almost. There we go. That's better.
All right, now let's get your blood sugar.
Y'all do what y'all want to do.
All of her vital signs are good. I don't see any signs of head trauma. So most likely, her only complaint is gonna be intoxication tonight. In New Orleans, people who are showing clinical signs of intoxication, we have to transport those people to the hospital just to get a little checkup, sober up a little bit, and then be on their way.
We're not gonna be kicking anybody. That's not nice. That's not nice. Yeah, I'm just trying to bring you somewhere so you can get some nice rest, sober up, get some food. I noticed that my girl is wearing a Mardi Gras t-shirt, and it's just another reminder that Mardi Gras really is just like so different this year. What are you cursing at me for? Are you sad that Mardi Gras isn't having all the praise this year? I think we're all sad. Yeah, as soon as you sober up.
I'm headed uptown for a 2-year-old with a bead stuck in his nose. This is a very common pediatric call. This is the perfect age where exploration is everything, and they like to shove stuff in their noses. 6249, I'm on scene. Hi, how are you? What's going on, Mama?
My 2-year-old, he's complaining that his nose is hurting. So I look in his nose, he got beads, like bracelet beads. I ended up getting one out, but then when I look back with the flashlight, there's one like way back there.
Let me see.
It's this side.
It's so hard to see. It's pink.
Mm-hmm.
Let me see something. You feel that?
It's deep down, because I took one out.
Is that even a bead? Or is that just his nose? Actually.
It is.
But it's way, it's way back here to the point where you can't even
get it out.
You can't even feel it, yeah. Why you did that? Can you blow your nose? Can you blow real hard?
Can you blow your nose?
Do it, real hard.
Blow.
Blow. Do it again. Big one. Nothing but boogers. At this point, my only other options to keep him from being transported is to try and use suction. I don't have suction. So at this point, I have to call an ambulance, which is good because, you know, I can use their suction, and if it comes out, then great, and if not, then they can take him to the hospital where they'll get it out.
Oh, look at you!
He's just like every other little boy. He played shy for about 2 minutes, and then we were home free after that. You ready? Let's go see if we can suck this thing out. Hi, Perez. All right, buddy. The problem is the bead is like to the left.
That's the bead? That's not his turbulent?
At least I think, Mama, the beads were pink, right?
Yeah, they were pink.
I would say that's his turbulence.
Yeah, now that you got the light right there and he's laying straight back, maybe he doesn't have any more in there. Can you breathe?
Yeah.
Breathe. Breathe out of your nose. Close your mouth. Breathe. Mama, that looks like his nose now that we're
see
yeah, let Mama see it.
See that little pink?
Yeah. I don't know. Yeah, it kind of look like some
Because look on this side, and it's the same kind of a similar color.
Let me see. Yep. Yeah.
Yeah, now that we got the light. No, that's all right because it looked like it to me too. Yeah. Do you want to take him just to be safe, or you want him to stay home?
What y'all think?
Do you feel like it's stuck in there?
You got something in your nose, True?
Do you feel like it's in there? No? I mean, you can always watch him. You can follow up with your pediatrician.
Yeah, I will.
All right. Once we get him into the ambulance and we're able to look at both sides in really good light, there's no bead in there. So, you know, I essentially just got a play date, and that was fantastic. All right, come on, we were just kidding. Let's go inside. You ready? Let's go. All right, my man. It's always the boys that stick beads in their nose. Little girls don't even do that with their own beads. Little boys always do. Hopefully I don't catch you no more. Bye, True. Man, I thought that was a bead, though. I got played. Now he gets to stay home and possibly shove more beads in his cute little nose.
Okay, 6246 advise you'll be responding to the shooting. I have 6248 and I have 2 units that headed that way. Are you gonna stand down or are you gonna respond with them?
No, I'm gonna go to the shooting. So we have 3 victims of a 34 assault.
10-4.
How many units we have on that one?
We have 2 units on that.
Can we start heading third one out that way, please?
45. Wait. Secondary trauma activation is another in the same location.
So far, I think that's 4. As a supervisor, when I get to a scene, I want to find out how many victims we have so that I can tell dispatch how many units we need to send. I need to try and find that out as quickly as possible. 6220 on scene. I get on scene and there's 2 victims already left by ambulance to go to the hospital. I go to the second unit to see if they need any extra hands. How many you got?
That's in addition to the already 4 victims we have.
Y'all got 2 in there?
Yeah, both trauma activated.
I'm on spot. Do y'all need another unit?
Well, no, it was for the 2 patients.
All right. There's nobody else, just these 4? You got it?
Yeah.
All right.
Need extra help from somebody at University 76 to help us unload.
Fire. Can I get one more to ride in, please? All right, 3245's got 2 room 4s. They getting ready to roll out. We are going to go to the other side, the back side of the complex. Police may have other victims back there. We'll let you know.
10-4, I have another one that's less than 10 out.
All right, 10-4. So that's 4 we got so far. When I get advised that there's possibly more victims, of course my mind starts scrambling like, do we have any units clear? Is this person still alive? So there's a lot that goes through my mind all at once, honestly. All right, we PD and jump out and make sure we don't have nobody else. Hey, y'all got any more? You got anybody else? Nobody else, huh, baby? Okay. All right, 6220, there's nobody on the backside. So that's all the victims that we found so far. You can send that other unit down. If there's anybody close to University, a Sprint, anybody that can give those units a hand offloading those 4 guys.
They have Alpha 3238 and Spanish 5 for 15 minutes at University.
All right, 10-4. Gonna roll up to University with them. Give them a hand.
The big heroes of the Big Easy are back in a new season of Nightwatch.
Your new caller, 20-year-old female.